Hey, we're on location today at Behavioral Health at Vidant Medical Center, and we're here with the medical director of the facility, Dr. Thomas Penders. Good to see you, Dr. Penders. Let's talk a little bit about what goes on here at Behavioral Health at Vidant Medical.
Okay, so we have a 52-bed inpatient behavioral health service here serves the community, a fairly broad community. Eastern North Carolina is essentially our referral area for people who've gotten severely depressed or who have severe chronic mental illness such as schizophrenia. And when they're getting to the point where they can't cope in the community, they come in here and we take care of them, try to organize their aftercare, their care in the community, and essentially provide services to them that will get them ready to re-enter the community.
And this is an inpatient facility. I know you also work very closely in fact, on the faculty at the Brody School of Medicine with the ECU as well. Talk about that interaction.
Okay, so this is a training site for the residency in the Department of Psychiatry and Behavioral Medicine. And the trainee psychiatrists actually get their experience in how to treat people here. So a lot of the care is provided by the trainees, by the psychiatric residents, and we serve a role of supervising them. They do a pretty good job.
Another great example of the synergy between Vidant Medical and the Brody School of Medicine, which we always love to hear about. Mental health is such a big part of people's well-being these days, and I know that in our modern society that there are a lot of issues, and people, you probably have a lot to deal with here. It's great to have a facility like this in our community. What's different about what goes on here at Vidant Medical Center at Behavioral Health?
So we have some expanded treatment services that are not available at your average community hospital. One is we have a very large recreational therapy department that provides a lot of services that help people learn coping skills, and they actually do counseling here. And you find that a lot of inpatient psychiatric services do not provide counseling. In addition, we have some specialty services. We have bright light therapy, which we've found to be quite helpful with patients with seasonal affective disorders. We do electroconvulsive therapy here, which some people may think is controversial, but it is the most effective treatment for depressive illness that we have. We have probably a more psychiatrist here than your average inpatient psychiatric program. So we can maybe have a little bit more personalized attention for our patients.
Once again, a great example of the great facility that we have here at Vidant Medical Center, and the beneficiary, of course, we all are here in Eastern North Carolina. It's great meeting you. Thank you for what you do for us, and we appreciate you telling us a little bit about what goes on here at Behavioral Health at Vidant Medical Center.